pretty male skull, actually. Are we on the air? Okay, so here's the kinds of things that I like to ask about the skull. And usually they have to do with the openings of the skull. The first opening, obviously, is this one right here, which is the superior orbital fissure. And there's a whole lot of different things living in the superior orbital fissure. Obviously, there's going to be the cranial nerve number 3, very active in that area, oculomotor, and there's going to be trochlear number 4. Number 6 is going to be the lateral movement of the eye. Abducens abducts the eye. And then there's going to be that one division of number 5 that's the ophthalmic. So division number 1, and that's going to be doing sensation. Ultimately, that division is kind of interesting, and we've done the cranial nerves now enough to know that that division of number 5, trigeminal, is going to come right up through here, and it's going to actually innervate the skin in the upper region of the eye and the upper lid. Okay, so the other thing that's going on in this area, will this fit? No, it won't. Maybe you can see this little wire coming through here. That's actually going through the optic canal for cranial nerve number 2 to come through. Cranial nerve number 1, we've actually lost the holes here. So these holes would normally be, this is a plastic model, it's a mold. And so cranial nerve number 1 olfactory would be up there. So then what else do we have? We have the rest of number 5. Division number 2 of number 5 is actually going to go through this opening, which is the rotundum. Okay, and it's going, the rotundum is going to meet up actually with the infraorbital foramen right here, and that means that same nerve is going to come out. At this point it'll be called maxillary nerve, and it's the number 2. You can actually see, right, ooh, that's kind of neat. I can see how the wire fits right through there. Okay, so anyways, that's going to be that skin area here. It's going to be all of these teeth are going to be innervated by that nerve, the maxillary division number 2 of trigeminal. And then back in here again, remember that we have the rotundum, the ovale, the spinosum, and here the ovale is going to transmit number 3, the mandibular branch of the trigeminal nerve. And as we come down, I'm bringing the wire down, I'm noticing that the wire will go right into the mandibular canal. That's kind of a nice deal. So then these teeth down here will get innervated by this mandibular nerve of trigeminal. It will come out and it will provide the skin in this region in the lower lip with innervation. Okay. Along the way, actually, it's going to take care of the tongue. So the tongue is in the oral cavity there, and a branch will come out and take care of the tongue for sensation. So you'll know your crunchy or your soft cookies, right, in that regard. We do have, remember the 1, 2, 3 is the rotundum, ovale, spinosum, and the spinosum is where we have the middle meningeal artery coming out, and you can actually see a little bit of the impression of the artery right in the bone. So if this artery were to be interrupted due to a fracture on the side of the head, that means that there's going to be epidural hematoma, and the brain will get pushed against right here, this little posterior odontoid process is what it's called, of the sella turcica. It looks as though this model got a little squished here because there's actually in the sella turcica supposed to be the pituitary gland seated right there, and the optic chiasma comes across here. Okay, so usually there's a little more, shall we say, gluteal space for the pituitary gland to be seated there in the Turkish saddle. And this is that lesser wing right here of the sphenoid bone. As we move back further, then we have, now this is a nice one right here, because I'm seeing, do you see how the wire comes up through here? That's how the internal carotid artery comes up. It actually lies down against the bottom of that canal, the carotid canal, and then it turns back up again. And the fact that you can see my finger, the skin of my finger underneath the foramen lacerum, indicates that there's a space there, but it doesn't exist in life. Okay, it was cooked out of the skull. There was cartilage there, hyaline cartilage, where the finger is. Okay, so then the next opening is in here, and that's going to be the internal acoustic meatus or auditory meatus, and that's where cranial nerves numbers 7 and 8, facial and vestibulocochlear, are going to go in here. 9, 10, and 11 will be situated in this location. So 9, 10, and 11 are the glossopharyngeal vagus and accessory nerve. And then number 12 will be going through this sort of little spot here. Maybe I'll use this stick, although it doesn't quite fit, through that spot right there. Okay, so that's going to be the hypoglossal canal conducting the hypoglossal nerve, and that's cranial nerve 12. Okay, so I think that's all for